Chapter 8, Articulations, which means joints. So a joint is a connection between bones. The joint may or may not be movable, and bones are connected directly either by cartilage or by dense connective tissue, or there may be fluid between them in the joint, like in a synovial joint, as we'll see in this chapter. So again, connections between bones are joints or articulations, either term. Their functional classification is based on the degree of movement at the joint. Synarthrosis is an immovable or a slightly movable joint, and amphiarthrosis is a slightly movable joint, often in the axial skeleton, like in the pubic symphysis. A synarthrosis or a synarthrotic joint would be like the sutures in the skull. And then the diarthroses, or a diarthrotic joint, are the freely movable joints, like the joints you're most likely to be familiar with, like your limbs, your digits, your fingers, those types of joints. Excuse me. The structural classification is based on presence or absence of a joint cavity. So a fibrous joint is comprised or has fibrous connective tissue, but there's no joint cavity, like the articulation between the tibia and the fibula distally by the ankle. That would be an example of a fibrous joint. And we'll get to this other terminology as we progress here. A cartilaginous joint has cartilage, but no joint cavity, like the pubic symphysis at the anterior junction of your two hip bones. And then a synovial joint has a joint cavity, space inside filled with synovial fluid, which is freely movable. And those are the diarthroses joints. So let's look at fibrous joints. They're comprised with or bound together with fibrous connective tissue between the bones. Examples would be the sutures in the skull. The bones interlock and there's dense fibrous connective tissue at the joint, making it a synarthrotic joint, meaning no movement. Or a gomphosis. The gomphoses are the joints between the teeth and their sockets in the mandible and the maxillae, the teeth and the alveolar fossae, the openings in the jawbones. There's a ligament there, periodontal ligament, that holds the tooth in place. So immovable, slightly movable, but immovable. So that's a synarthrotic joint. Another example of a fibrous one. And down here at the bottom, an example of an amphiarthrotic or amphiarthrotic joint, or an amphiarthrosis, would be the distal joint of the tibia and fibula. Ligaments hold those bones together. There's a little bit of movement. So it is an amphiarthrotic joint and a fibrous one. And that example is a syndesmosis, the ligament holding the bones together. Cartilaginous joints, again, no joint cavity, cartilage between the articulating bones. Examples: the synchondrosis between the first pair of ribs and the sternum, the manubrium of the sternum. There's hyaline cartilage at the joint, a little bit of movement. And then the symphysis type joint, for example, the pubic symphysis, where there's fibrocartilage between the pubic bones. And a little bit of movement, so it is an amphiarthrotic joint, just the way the synchondrosis joint is having a little bit of movement, are also amphiarthrotic. And moving on to the freely movable joints, the synovial joints. They are diarthrotic, freely movable or highly movable. They're somewhat complicated joints. They have more things in them. So they have articular cartilage, a type of hyaline cartilage covering the contact surfaces of the bones. They have a joint capsule that encloses the joint, which makes the cavity internally. There's accessory structures, ligaments, which can be external to the joint capsule, and sometimes they're internal. And then also internally there can be discs and or bursae. So schematic of a simple synovial joint. Articular cartilage covering the ends of the bones at the articulation, type of hyaline cartilage. Helps reduce friction, acts as a shock absorbing structure, that hyaline cartilage. It has no perichondrium surrounding the hyaline cartilage, but just think of it as articular hyaline cartilage. There's more water in the ground substance of this type of hyaline cartilage, which gives it a better shock absorption characteristic. The joint capsule, as you see, surrounding the joint. It connects to the periosteum. Remember that tissue that surrounds bones. The joint capsule has two layers. Here in gray is the fibrous capsule. It's a superficial layer of the joint capsule, fibrous connective tissue, nice and strong. And then internally, in looks like pink here, is the synovial membrane, producing the synovial fluid, which lubricates the joint and actually nourishes the chondrocytes within this cartilage. Okay? And that's areolar connective tissue, and it has a thin, incomplete epithelial lining. So that synovial fluid lubricates and reduces friction at the joint, nourishes the chondrocytes that are in the cartilage. The fluid enters and exits the cartilage as stress forces are acting upon the joint, or as you're moving around, walking, that sort of thing. So the cartilage is kind of, think of it as a sponge that can absorb water and release water when you squeeze it and release it. The hyaline cartilage, articular hyaline cartilage, absorbs the synovial fluid and releases it with movement, and then that draws in nutrients into the chondrocytes within that cartilage, like so. And the fluid also acts as a shock absorber because fluids tend to be non-compressible, so they do function as a shock absorbing agent, the synovial fluid. Okay, some of the accessory structures. Cartilage and fat pads. So in a complex joint, synovial joint like the knee, there's a number of accessory structures. The cartilages internally and fat pads help modify the shape of the joint and help give it some structural integrity. Menisci, meniscus is singular. They are articular discs, and they're fibrocartilage pads. As you can see here, meniscus cut in longitudinal section here. And they can subdivide the joint, giving it some more stability, as we'll see with the knee menisci. And with movement, they kind of change the shape, adjust the shape of the articular surfaces as they move. helping to direct the flow of the fluid and giving the knee stability and structural integrity as it moves, bends in this case. So the fat pads that you see here, one a little bit anterior, a little bit posterior, they help protect and cushion the cartilages and help fill in spaces, cavities around the joint. Ligaments, made up of dense regular connective tissue, help stabilize the joint. They help bind the bones together. So the extracapsular ligaments, extracapsular, so they're external to the capsule. They're outside the joint cavity. And I don't even know if there's one shown here, but we'll see one soon enough. External to the joint cavity. And then the intracapsular ligaments are internal. And there's one here, intracapsular ligament. And we'll see that there are two in our knees, internal. Excuse me. Tendons are not part of the joint capsule. They're external, but they do help strengthen and stabilize the joint. For example, here's the patella, and here's its tendon that attaches to the quadriceps muscles, the anterior front muscles of the thigh. If you remember, a tendon attaches muscle to bone versus a ligament, that's the patellar ligament. That ligament attaches the patella to the tibial tuberosity on the tibia. Oh, and by the way, that would be an example of an extracapsular ligament, that one there. It's external to the capsule, to the joint capsule. So bursae are small liquid-filled pouches, pockets within the joint, and sometimes external to the joint. And, oh, here we go. In green, see the bursae here? And they're often found in places where ligaments and or bone are moving to help cushion them and lubricate them in a way, to reduce friction. And they tend to form where tendons and or ligaments might rub up against other tissues. We'll see a number of them in the shoulder joint as well. Excuse me. And then synovial tendon sheaths. These are bursae that surround and wrap around tendons that might cross bony surfaces. And if you've ever had bursitis, those are inflamed bursae and cause painful swollen joints. A little bit on strength and mobility of joints. So joints can't be highly movable or mobile and really strong, structurally strong. There's a trade-off. So the greater the range of motion, right, the more mobile a joint is, structurally it tends to be weaker. If we look at this little figure down here, the greater mobility of a joint, the less stable the joint. As the joint becomes less mobile, like say the sutures, they become much more stable. So notice one of the more mobile joints is the shoulder joint. It tends to be one of the least stable joints in the body. So synarthrotic joints that are immovable are the strongest, and then the diarthrotic joints that are highly movable tend to be the weakest of the joints. And so factors that limit mobility and increase stability, ligaments and collagen fibers of a joint capsule for synovial joints. So for example, the elbow joint is more stable than the hip joint, which is more stable than the shoulder joint. Okay? So there's more ligaments that are binding the hip joint together and the elbow joint, in addition to the bone structure of the articulating bones. And the shape of the articular surfaces will limiting certain specific movements. The hip and shoulder joints are both ball and socket joints, but the hip joint is a deeper one, less range of motion, structurally stronger.